Hello students, welcome to Iron Deficiency Anemia. Anemia always has been and will always be one of the most important topics because the frequency and the chances of examiner asking it in the question paper are very high. Very easy. If you have been following along all your syllabus, then anemia should not be a problem to you. So here in pathology, iron deficiency anemia is most important, which is a type of microcytic hypochromic anemia caused by inadequate iron availability for hemoglobin synthesis, resulting in reduced oxygen carrying capacity of blood. See, microcytic, you understand, micro means small, cytic means cell size. Hypochromic, hypo means less redness, less color. So this leads to reduced oxygen capacity of blood. So when there is less oxygen, less hemoglobin will be formed. So what definition you have to write in an exam? Iron deficiency anemia is anemia resulting from decreased iron stores, leading to defective hemoglobin formation and production of small pale red blood cells. Microcytic hypochromic causes. Most important cause is chronic blood loss, which may be due to excessive bleeding in the case of menses or piles. Also, increased requirements. There are certain periods in life, such as in the pregnancy, the basic requirement goes very up, or the child is in growing stage. In the first few years, a lot of nutrition is required by the body. Third is inadequate dietary intake, that the required level of iron, which is needed daily in our diet, we are not taking, and that can also cause iron deficiency anemia. And last is malabsorption. Malabsorption is that the input is proper. You are taking the required amount of iron in your diet, but your body is not able to absorb it. So net result is there is a loss of iron causing anemia. Pathogenesis. See, you have to remember that iron depletion first reduces iron store. In our body, iron is stored as ferritin. So our ferritin level goes down, which follows by decreased serum iron and increased total iron binding capacity. Meaning, whatever iron is left is bounded and not available for the body to use. This leads to reduced hemoglobin synthesis, leading to microcytic hypochromic red blood cells. What are the laboratory findings? First is low hemoglobin, second is low serum iron and ferritin, third, increased total iron binding capacity, and fourth, microcytic hypochromic RBC on peripheral smear. In CBC, one of the important parameters which is present is hemoglobin. Serum iron and ferritin are specialized tests which are gold standard. If the doctor wants to go to the next level to understand why there is anemia, he can order that. And peripheral smear, you might have done it in your first year. It is the most important test. But the one thing I always say, master your peripheral smear because this is something very practical and would always help you. When you do the staining using Leishman stain, you can actually, under a nice microscope, you can actually see these smaller, paler cells. Clinical features: pallor and fatigue. The patient would have a lack of redness. The people who have a healthy hemoglobin, they are reddish and pinkish tint their skin. Fatigue, simply, even if they do a normal walk, they would suddenly have shortness of breath. That shortness of breath is not due to pulmonary causes, but simply because the lack of iron is making the body go tired very fast. Glossitis and angular cheilitis. See, glossitis is simply inflammation of the tongue. The tongue becomes swollen, red, and smooth, shiny, which causes difficulty in swallowing or speaking. Next is angular cheilitis. This is a redness, swallowing, painful, cracking. Where is this present in the angular cheilitis? On the area where the lips meet. So this point becomes very painful, dry, cracked. Third is koilonchia, which is spoon-shaped nails. Simply, we know that our nails, spoon-shaped nails, simply put, our nails are convex, but in this case they become concave, as if the nails become deep enough to hold a drop of water. What are few exam-oriented key points? It is the most common type of anemia worldwide. Serum ferritin is the best indicator of iron stores. If you're not able to understand why there is low hemoglobin, ask for serum ferritin investigation. Chronic blood loss is the most common cause in adults. See you in the next topic.